All right, what's up, everybody? It is going to be day 2 of CCRN, cardiovascular concepts, following along with the classic Barron's textbook. On day 1, we stopped with the heart sounds, and today I want to kick back off and start back with, let's see, the abnormal heart sounds is where we're going to be today. So, had some audio issues for a second. All right. I need to find a video on abnormal heart sounds. Nursing, let's see. So we're going to be looking at S3 and S4 heart sounds, which are abnormal. So let's get our cardiovascular assessment concepts here in Anki. All right, let's see what this S3 is all about. And listen to, oh, what is this? Nurse Sarah, is that her name? Let's see. All right, let's check her.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to be going over heart sounds. What I want to be doing is I'm going to be covering the basics of the things you need to know about listening to those heart sounds, S1, S2, those extra heart sounds like S3, S4, heart murmur. And in the next video, I'm actually going to be performing an assessment on a person and showing you by using the stethoscope how to find those anatomical positions when listening to the aortic, pulmonic, tricuspid, and mitral valves, and walk you through how to do that. Now, after this video, be sure to go to my website, registerednurseRN.com, and take the free quiz that will test you on this theory of listening to heart sounds, because a lot of times in your health assessment classes, for instance, you may be asked certain questions about when do you hear S1, where do you hear it best, and things like that. So that can help you prepare for your exams. And a card should be popping up so you can access that quiz. So let's get started. First, let's talk about the goal. What is the purpose of listening to heart sounds? Well, the reason we listen to heart sounds is to assess the closure of heart valves that are located in the heart, where blood flows through, because it tells us a lot about what's going on with the patient's heart.
Where's the S3?
What's up, Ninja Nerds? In this video today, we're going to be talking about heart sounds and heart murmurs.
Here we go.
We're going to put A2 and P2. Let's come to the S3 and S4. So S3 and S4 are interesting sounds.
S3 and S4.
They're extra heart sounds. So now we should know that you'll have an S1, and then you'll have this A2 and P2. So we're going to put S1, and we're going to put A2 and P2. That's the S2 heart sound, though. You add another heart sound in this, which we're going to talk about as S3. S3, the concept behind this is there's left ventricular dilation. That's the words I want you to remember. There's left ventricular dilation, so these ventricles are gargantuous. And so what happens is the actual left ventricle can easily fill. They actually rapidly fill with blood. And as they rapidly fill, the blood bounces off the walls of the ventricles as it starts to distend, and it creates this turbulence of blood flow, which triggers a murmur. That is that turbulence of blood flow within the super dilated, rapidly filled ventricles is the S3 heart sound. So again, just to recap it, it's going to be rapid ventricular, we're going to put in this case left ventricular filling, which creates a massive turbulence of blood flow within the left ventricle, and you could say the right ventricle. And that is what precipitates.
All right, so basically our S3 and S4 heart sounds are not supposed to be heard, and the reason this is happening is because we've got dilated ventricles and blood is rushing back in through those valves after the systolic, and it's saying it's starting at the top of the S3 sound. Let's see. Now let's make a card on this, and we'll have ChatGPT. Let's put on a little relaxing music real quick. Let's go back to our OpenStax book. All right, 24.3. So specifically, starting off, start with the S3 sound, or a ventricular gallop occurs after the S2 sounds, like lub dub da, lub dub da, dub dub da. Okay. Dub dub dub. Fluid overload. Or in pregnancy. Okay. A blue with fluid.
Precipitates the actual extra heart sound. All right, so that is going to be the S3. So this will precipitate what sound? The S3. So then we have to ask ourselves the question, what's the reason for the rapid left ventricular filling? Super dilated ventricles. What are some causes of dilated ventricles? CHF, which one? Systolic heart failure. So one cause would be systolic heart failure. The other one would be dilated cardiomyopathy, would be another really, really big one. This can happen not just pathologically, but physiologically. Sometimes in patients who are super young and healthy athletes, they can have dilated ventricles so they can trigger super large stroke volumes. So you can see this as well in young athletes. So these are the concepts that I want you guys to understand as the causes, whether it be pathological or physiological, of the S3. So we know that it's during the filling process. So that means that these valves are open. The mitral valve and the tricuspid valve are open. So if those are open, it can't be after the S1, it's got to be after the S2, because they're closed from S1 all the way to S2. During S2, after that, they open up a little bit again. So the sound would have to be right here and have to be very early. So what we're going to do is we're going to add in this extra sound here. We'll do it here, where there's going to be a sound that comes right after this, and this is going to be the S3. So you'd have S1, the S2, which is the combination of these, and then right afterwards, the S3, if you have systolic heart failure, dilated cardiomyopathy, or very young, healthy athletes. Let's go into this next one. So S4 heart sound, what do you notice the difference between? Let's go into the combination of these, and then right afterwards, the S3, if you have systolic heart failure, dilated cardiomyopathy, or very young, healthy athletes.
All right, so S2 is, let's go back to our first heart sounds. S1 is the closing of the tricuspid and bicuspid valves, end of diastole, beginning of systole. S2 is the closing of the semilunar valves, aortic, pulmonic. So A2, P2, I think that's what it's saying. That's S2, and then our S3 coming right afterwards. So okay, so the ventricular. picture down here real quick. So I don't think I've actually ever heard an S3 particularly. Maybe if I was paying attention. It's kind of why I want to get one of those new Echo stethoscopes. I'm sure I've heard an S3, I just didn't realize that that's what I was hearing. Sudden tension of the chordae tendineae ventricular walls creates the low frequency vibration heard as S3. So I think on this card, we'll just do S3. Yes. I kind of want to be able to explain that. So maybe what we'll do is we'll do two closed deletion cards like that. All right, so S1, S2, and S3 right after S2. Ventricular gallop or Kentucky. Let's go to S4.
Let's go into this next one. So S4 heart sound, what do you notice the difference between the ventricles here? Thin, super dilated ventricles, thick ventricles. So whenever you have a very rigid left ventricle, it actually will do what? It will decrease ventricular filling. And if you decrease the ventricular filling process, what this does is this causes the atria to have to generate a very high pressure. And so the atria will contract super late. So you develop a late atrial contraction because the atria are going to have to really work very hard to push blood from the atria and the ventricles because of the super high pressure in the ventricles and how poor their filling process is. So again, rigid left ventricle will decrease the ventricular filling. That'll make it really hard to get blood into the ventricle, so then the atria has to contract and very powerfully. And when it does, it generates the S4 heart sound. So the S4 heart sound is usually the result of the atria super working hard to contract and squeeze blood down. So it goes hard to get blood in. Whenever that happens and it makes it difficult to get blood in, the atria will then pound on the remaining blood in the atria to squeeze it down into the left ventricle. That is referred to as the S4 heart sound, but it comes later. So it has to go S1, A2, P2, which is your S2, and then in comparison to S3, S3 will come right afterwards if you have a dilated, rapidly filled ventricle. For S4, it has to come a lot later because now the atria have to contract to push the remaining amount down. So this would be your S4, and S3 will be somewhere in here as comparing the two. So now we've compared S3 and S4. The question comes is what's causing this rigid left ventricle to not fill? Diastolic heart failure. That would be a big one where they're super kind of hypertrophic and very poor at being able to fill. Another one is anything that causes left ventricular hypertrophy. What are two things that cause left ventricular hypertrophy? Aortic stenosis. This will definitely precipitate left ventricular hypertrophy. And if you hypertrophy this, can you feel it? No, it's a very small space. And the last one is chronic hypertension. This will also precipitate left ventricular hypertrophy. So these are the things that I want you guys to remember for the causes of an S4 heart sound. Okay, beautiful. At this point, we've covered normal, S1, S2. We've covered what happens when you have a dilated, rapidly filling, turbulent left. Okay, beautiful. At this
All right, grab our screenshot here. Atrial Gallop, Tennessee, Kentucky, Tennessee. Okay, I'm trying to. That'll wrap up our S3 and S4 heart sounds. I like those cards. Yeah, just kind of getting started and doing a little bit today. We'll wrap it up there. Good luck out there with your studies, everybody. All y'all take care. We'll see you in the next one.